Hi, everybody. It's Jaimie Boyd here. It's an absolute pleasure to be connecting with everybody. So we have two goals for the call this month. We're going to do a very brief update on some of the progress on the digital framework. And then we have a special guest joining us today. So Corrie Barclay is joining us, and she's going to tell us a little bit about the health sector's digital response to the COVID-19 pandemic. Quick updates on the funding models. This is the piece that's being led by the Digital Investment Office. I'm pleased to report that work has moved forward quite swiftly, and we do finally have some recommendations. We'll be seeing those within SITS this week, and I'd be very happy to share that with anybody who is interested. This is really a question of making sure that we are funding technology in ways that are appropriate and conducive to success across government. On the policy front, as a reminder, this was an effort to update our policy framework for digital change, focusing on Chapter 12. On this, there was a fairly mature draft, and the team, we were all delighted. Over 200 comments came in, so thank you to so many of you who took the time to review that chapter in detail. We'll just be waiting for our day with Treasury Board and internal approvals. Around modern tools, I think I mentioned that we've been really pleased out of OCIO to see lots of progress in the deployment of these modern digital tools. Of course, there was Ministerial Order 85 that did facilitate some of the adoption of these new tools, but we've also seen lots of leadership from across the ministries in terms of adopting and aligning with best practices. I think in the past I've spoken about our hosting and application development framework, which is an effort to map the future blueprint of IT in government, and an initial version of that has been shared on GitHub. We would really welcome any comments or feedback on that initial draft. And finally, within the framework, we had made commitments around increasing and improving the use of platform services and tools. So the good news is around the DevOps platform that's being run out of the lab, so the OpenShift Red Hat instance. We have done a fairly robust assessment of the platform and improved its availability. And now the team is working hard around application configurations. And of course, there's going to continue to be lots of work around common components. I'm delighted to welcome Corrie Barclay to the call. Corrie, for those of you who don't know her, is the ADM responsible for digital change at the Ministry of Health. And so without further ado, I will open it up to have a bit of a conversation with Corrie around her experience. So Corrie, can we plunge right in? How have things been going for you?
Hi, Jaimie, and yeah, thanks for inviting me to this session.
Okay, so then first question, I would love to hear about the Ministry of Health's experience with the pandemic to date. So what were the actions that the ministry took? What kind of services did we launch as a government to support public health?
So the first thing that I think most of you are probably familiar with is we wanted to really equip citizens with a tool to help get information out and help them do their symptoms checking, because there were so many questions coming in. We quickly stood up the COVID-19 digital app and website for citizens. And to date, we've had, I think, 2 million visits to that site and over 200,000 downloads to that app. And the purpose of that app was to really push out information, education, and then, of course, do your symptoms tracking so you would know, do I have COVID? What do I do if I think I have it? We've actually produced a dozen digital services and products that have come out of COVID-19. I should also mention that everything is through a partnership. I think I've just been so impressed with how quickly we came together with our health authorities, Provincial Health Services Agency, OCIOs, other ministries, and within the ministry, and just everybody is united around a single priority and purpose. You mentioned the digital assistant, where that was a really fun project to do with the collaboration with OCIO. So it's our little chatbot that we have. We've had 500,000 sessions to that digital assistant. And what's really interesting about that is we can collect what are citizens wanting to know. So it's helped us in understanding what is the top questions that citizens want, and then we can go get the answers update the digital assistant and just keep going with what responding to the citizens' needs and questions. We've been working a lot within the health sector on advancing virtual care for the province, but COVID-19 has accelerated the use of digital tools because we didn't really have a choice. Patients still needed care. They still wanted to consult and get service from physicians. So between all the health authorities and the doctors of BC, we stood up toolkits to support them with video conferencing, secure texting. So we were able to quickly provide those tools out. We wanted to take care of patients in their homes, and we had a suite of tools for home health monitoring. And TELUS actually really partnered with us, with Provincial Health Services Agency, and Island Health has been a real champion of that suite of tools, and we quickly added a COVID-19 protocol so that we could provide services to patients in their homes that had COVID-19. And there's been over 1,000 patients in their homes monitoring for that they either thought they had or they were at high risk or were diagnosed with COVID-19. Great profile for us in IMIT to really show that we can respond quickly, we can provide tools quickly and work together to meet a real need.
What worked? What were the strategies that seemed to have been most effective?
So the acceleration of working together, everybody focused on a single priority, having to make quick decisions based on what was best then. We find that moving to video has made us really efficient with our meetings. And of course, collaboration with private sector.
Are there particular strategies that you would recommend for other digital teams across government?
And we already had a digital health strategy where we were wanting to create a standards-based multi-platform ecosystem focused on the citizen. So we've had that. We've talked about that a lot. We had a lot of architecture documents and design, but I think that actually helped, is that we had a strategy, we had a vision. We rallied around standards-based multi-platform solutions. And so we were able to just accelerate all of our work that we were hoping to do in the next couple of years. So we've just made huge strides forward in that. And just all the traditional things that we say we want to do with user-centric design, working in the open, being agile, citizen-centered. So we had talked about it and we built a culture around that. So we were able to all start working quickly, to make it real. So it was great.
That's so encouraging. And I think, speaking from the OCIO perspective, we've certainly seen teams that are used to working in agile ways, that have embraced open standards and open source, really rising to the challenge quite more effectively and quite quickly. So it's encouraging to hear that. I'm curious about the path forward. So what are the opportunities for digital health in a post-pandemic world?
But I think we need to challenge ourselves in looking at how much we've progressed as far as digital health and virtual tools, and how do we keep building on that momentum. We have an opportunity to provide healthcare in a very different way for citizens, and a new channel that offers more convenience and more access to healthcare expertise and professionals. So we're looking at how do we leverage all the good work that we've done to keep moving forward to provide more services to citizens for healthcare where it's convenient for them. Really expanded what's appropriate for a virtual visit, because we've often challenged, I should see somebody in person or I should be seen in person. But we've really pushed that boundary to look at what could we provide virtually, what actually can work and still be clinically appropriate and safe. And just looking at leaders to think differently. So as a community of leaders, we've got emerging champions, folks that have done a complete 180, that have really held on to the traditional ways of providing services, that now realize it is a good balance. It is great to offer another channel for citizens.
It's interesting to hear you really highlighting the importance of the cultural change. I find that so often in digital government, the technology is not the limiting factor, but rather our ability to adopt it, or the governance and all those other things. So the first question that's come in is, what is BC going to do on contact tracing?
So we are looking at what makes sense for BC, and the privacy of our citizens is of utmost importance to us. So we are exploring the ability for a secure private functionality, but you would be able to consent and agree to some functionality that would allow you to be your phone to be tracked, but it would be held just on your phone so that we maintain the privacy. And that if you are diagnosed as a COVID positive, that you would be contacted by public health, and you would consent and be asked, would you share your phone information to public health? So having that information from your phone allows them to do a thorough follow-up and investigation to notify everybody that was in a certain distance or for a prolonged period of time. We're probably a month away from having a communication out to citizens on what we're doing.
Did you make use of any open source tools or collaborate with other provinces?
As far as working in the open and collaborating, we're moving to a guiding principle or a policy around any development that we pay for in the ministry or in the sector will be available in the open. When we move to contact tracing, every province that's implementing a contact tracing solution will have it made in the open. So they're very committed to working together. The work that we did with our COVID-19 app, that was made available federally. And we also are investing in a shared electronic medical record. So any new investments in that, we're looking at having that in the open.
And any particular lessons or anything you would have done differently?
It took a little bit of time before the digital response team was assembled. But it wasn't we were so focused on the healthcare side of things. Lessons learned would have been having that as part of the initial emergency structure that we set up.
Well, it's been incredibly inspiring to hear about your work. So thank you very much for sharing all of this with us. And thank you to you and your team for all of your leadership. We'll wrap it up there. Thank you very much, everybody, for your active participation. Over 200 people have been on the call. I'm delighted to see that there's that much enthusiasm and interest in all of the wonderful work that's been coming out of the health sector. So thank you for joining us.
Great. Thanks, everyone. Thanks, Jaimie.
Bye now.
Bye.